Let's talk about pleural effusions. What is a pleural effusion? Well, a pleural effusion is when you have fluid that is built up between your chest wall and your lung. So normally there's a little bit of fluid in there, and that helps with the normal expansion and movement of your lungs during breathing. But if you get too much fluid in there, then it's going to cause you some problems. So some of the things that will cause a pleural effusion: kidney disease, liver disease, congestive heart failure, pulmonary embolism, autoimmune disorders, TB, cancer, pneumonia. So all of those can cause a pleural effusion. So what are some of the manifestations of a pleural effusion? So these patients have some dyspnea, they've got a cough, and they can have really sharp pain that doesn't radiate. And when you ask them, is there anything that makes it worse? They say, yes, if I take a deep breath, it makes it worse. So it's worse on inspiration. There's also a thing called an empyema. So it is a collection of purulent fluid in that space. So again, it's a fluid collection in your pleural space, but it's infectious. So pneumonia and TB can cause this, a lung abscess, things like that. So with those, you'll have the same signs and symptoms, and you'll additionally have a fever. And then some of the things, when you think TB, what do you think of? You think of night sweats, weight loss, cough. So those are things that you'll see with an empyema. So how do you treat a pleural effusion? So with a pleural effusion, you want to treat the underlying cause. So what caused it in the first place, and treat that. So if it's CHF, if it's a kidney problem, if it's a liver problem, treat the problem. And then you're also going to do what's called a thoracentesis, where you draw out or aspirate the fluid that's in there. And if it's really bad, then you'll have to put in a chest tube. So that's a pleural effusion and how you treat a pleural effusion.